Mr. Chairman, leaders of the higher organizations, delegates, guests, greetings from the health ministries of the East Caribbean Conference. Permit me to share with you our highlights for the Quadrennial. Obstacles are plenty, overcoming is the victory, our theme for this session. However, permit me to say that health ministries face more challenges as opposed to obstacles which had to be managed. These challenges fell under three categories, namely non-communicable diseases, communicable or infectious diseases, and disasters. The video report will focus on the first two as disasters was managed under ADRA and community services. Non-communicable diseases, namely cardiovascular disease, diabetes, cancer, and respiratory illnesses. These are the main cause for morbidity and mortality in our region. We will focus on diabetes as this is one of the NCDs that contributes to a lot of amputations, disability, and even kidney failure as well as deaths. Diabetes, in order to manage, in order to overcome this great challenge, we focus on a couple things. First of all, Diabetes Reversal Program. 3 such programs were conducted and facilitated by Cheryl and Dennis Fally from Maine, USA in March 2017, and Jim and Neva Brackett from Washington, D.C. in February 2020. 2 of these programs were held in Dominica and 1 in Barbados. A total of 100 participants, 100 persons participated in those programs. Following the first program in 2017, Sister Pamela Payne Wilson, Sister Deborah Joseph, Sister Marcia Reese, and Sister Emil Edwards conducted similar programs in their churches or districts. Diabetes Prayer Breakfast was held in November 2018. A prayer breakfast was held in Dominica and 78 persons attended. In 2019, 2 other prayer breakfasts were held at different locations in Dominica, and 1 was also held in Barbados. Each prayer breakfast was followed by a digestive walk. A virtual Diabetes Day church service was held for the first time on November 14, 2020. A total of 1,100 persons viewed that program. A Zoom webinar was also held for healthcare providers, and that was on the 17th of November. The programs conducted in Dominica were done in partnership with the Dominica Diabetes Association, who provided financial resources and the participants from their membership. From anecdotal reports where reversal has not been achieved, participants have recorded improved glucose levels, reduced medication requirements, fewer complications, and reduced hospitalization. Acceptance among health professionals that diabetes can be reversed is another achievement. A health promoters training was held for the first time in the Caribbean Union, which was conducted between the 5th and 11th in collaboration with the Caribbean Union and the Inter-American Division. Both the IAD Director, Sister Belkis Archibald, and CARU Director, Pastor Alexander Isaac, along with USC dietitian, Sister Dr. Claudette Mitchell, and other ECC presenters facilitated the training. 80 health promoters from Barbados and Dominica were certified and received resource materials for continuation of the program. Caring for the carers. It was recognized that our carers needed some information on how to better care for themselves while providing care. This initiative of the East Caribbean Conference was conducted September 15 to 16 in Dominica and September 22nd to 23rd in Barbados. The aim was to help caregivers recognize that while they give care, they should be mindful of and prevent burnout and stress. The training was facilitated by Pastor Neve George, chaplain at the Port of Spain Adventist Hospital, Dr. Marcia Cambridge Maxwell, and also helping facilitating the program. 60 persons participated. The next great challenge we had was that of COVID-19 pandemic. In order to manage this, information and education regarding the pandemic were provided to churches and community members through various means. We had coronavirus newsletter sent in, circulated, video productions and circulation, virtual seminars and webinars, digital New Start infographics and New Start webinars, compliments Brother Julius and Julian Seeley and the Southern District in Barbados. WhatsApp messages from the East Caribbean Conference Health Ministries, ECC Staff Chat, and Dominica Ministerial Association and the National Elders Chat. Radio program, Power Breakfast and Healthy Living on DBS is one of the main features in Dominica as far as health is concerned. Every Tuesday at 11:15 to 11:45, Healthy Living is being broadcast locally as well as via the internet. And Power Breakfast alternate weeks provides breakfast menus for Dominicans and overseas persons as well. Several sessions were held in partnership with Women's and Children's Ministries Department, covering topics related to women's health and disaster preparedness. Health Week was also conducted virtually 20th to the 26th of September 2020, and we had Professor David William. We also had Dr. Sandra Reed from St. Augustine Campus, Trinidad, Dr. Nathalie Graves from Cave Hill Campus, and also Elder Jim Brackett, physicist and lifestyle health educator from the USA. The virtual program attracted a total of 24,000 views. The program was also aired on Nothing But God Radio in Barbados, DBS Radio, Kyrie FM, and Northern Broadcasting Stations in Dominica. That program was very impactful and cost-effective. Exercise programs. The following churches operated regular exercise classes during the period: Workman's and Black Rock, Silver Hill, Breath of Life, and Maranatha operated health clubs. Black Rock continued exercise sessions via Zoom during the lockdown. Belle Plaine Health Team featured health walks and nature hikes during the period. Zoom exercise was also conducted during the last quarter of the Quadrennial in partnership with Women's Ministry. Nutrition. Beryl and Penville churches benefited from nutrition sessions during the 5th to the 6th of May 2018, as well as the Marigot Seventh-day Adventist Church in Dominica and the Pentecostal Women's Ministries Group in Roseau. Sister Esther Selman and her team conducted their annual nutrition conference along with nutrition webinars during the pandemic. Breath of Life and others conducted cooking classes. Cancer awareness. During 2019 and 2020, the Health and Women's Ministries Department of the East Caribbean Conference partnered with the cancer societies in Barbados and Dominica to increase awareness that early detection does save lives. The above programs could not have been accomplished without the dedicated efforts of health ministries leaders and health professionals on both islands. My administrators, Dr. Colin Thorne, Executive Secretary, Pastor Danforth Francis, President, and the Treasurer, Sister Dottin, they helped to facilitate all the programs that was mentioned. Along with my administrative assistant, Sister Cecil Connell, our overseas facilitators that have been mentioned, ECC fellow directors, And in particular, Women's and Children's Ministries Director, Sister Andrea Hudson-Hoyt and her family, and Pastor Alexander Isaac, Union Health Director. Special thanks to my family, especially my daughter Karen, for her tremendous support. Without the guidance, health, and strength provided by the Almighty Father, I would not have been able to present this report today. So I say, thanks to the Almighty, to God be the glory. Certainly, great things He has done. We look forward to this coming quadrennium as we focus on comprehensive health ministry, not targeting one particular disease, since all or most of the diseases have similar risk factors, and most people have more than one of these non-communicable diseases. So we are focusing on comprehensive health ministry, embracing all health professionals and non-professionals as well, and everyone who can contribute to better health, better living, and a people prepared to meet Jesus when He comes. So let us join together with comprehensive health ministry as we move forward. It was a pleasure serving you during the quadrennium. Water. This water is coming from the Bury Lake and flowing into the freshwater lake.